Following the declaration of COVID-19 as a global pandemic by the World Health Organization on 30th January 2020, many countries started marshalling their resources to keep the pandemic at bay. In his first national address on the outbreak of COVID-19 on 18th March 2020, President Joyce Museveni rolled out a raft of guidelines that were meant to limit its outbreak here in Uganda. Among these were restrictions on public gatherings, as well as the closure of schools that were meant to last only 32 days. However, the discovery of Uganda's first case of COVID-19 on 22nd March saw the country plunged into its first COVID-19 lockdown and the rollout of a number of standard operating procedures to prevent the spread of COVID-19. Dr. Alosia Senyonjo, a public health lecturer and researcher at Makerere University School of Public Health, says the country's response to the outbreak was guided by other countries who got hit earlier than Africa.
In terms of the strategies that we adopted, talk about masking, talk about tracing and contact tracing and isolation, quarantining, the travel restrictions were really borrowed from the international community.
As a result, Uganda got a number of things right at the beginning.
The government has tried to boost the resourcing to the health sector, but also they adopting a whole of government approach where different ministries, departments and agencies came together to look at what they can play in terms of a comprehensive response.
Most importantly, government also approved the use of local remedies to aid in the treatment of the signs and symptoms of COVID-19.
We were able to also have another broad discussion around herbal medicine, local remedies, at the time when there was no certainty around therapeutics and things that can be able to manage. People have their local testimonies.
As a result, Uganda's efforts were lauded on the global stage.
By the way, Uganda was even recognized in one of those UN General Assemblies. You know, there's something called the Lancet Commission. They published a report and say in non-pharmaceutical interventions, you know, there was no treatment for COVID.
But this notwithstanding, some things have not gone well too.
Now, when it comes to really taking care of those who fell sick, the issue of oxygen let us know. Ugandans were so desperate. It merely costs about $200,000 to set up a plant in the regional referral hospital. That's about 700 million.
This is in addition to the failure to take care of the health workers, some of whom have paid the ultimate price as frontline soldiers in the COVID-19 fight.
The moment ADF attacked, how many people died? Less than 20. I'm not saying it's good, but less than 20. COVID killed 3,000. We sent a full army to combat the ADF. That's millions of dollars. Logistics. Soldiers are likely to die. We lost 80 healthcare professionals.
Some of the restrictions imposed, like curfew, also affected access to other COVID-19 health-related services. They also argue that the country's COVID-19 vaccination program is still lacking in some aspects.
Concerns around logistics, people lining up where there have been big campaigns. So sometimes the concern around, first of all, is it an issue of demand that people are, or is an issue of our supply system not meeting that demand?
Going forward, a number of recommendations have been made.
That we in public health have not been humble enough to say this is an evolving situation. We have this different set of tools to fight the pandemic. But we can adjust as new evidence comes in. We can learn and change as we get to know.
Government also needs to prioritize the country's health sector.
And intern doctors are on strike, followed by the lab people and so on. So under the technical area of workforce development in national health security, because you cannot have that army of healthcare professionals without developing them. Apart from the numbers that we lack, which is a contradiction because we are producing so many, but they are not employed. Government areas do not have critical cadres like anesthetic officers.
Joyce Nakato, NTV Weekend Edition.